Welcome back for another deep dive into the world of medical imaging. And wow, are things moving fast in the X-ray market? This week we've got some seriously cool updates to talk about.
Yeah, we've got researchers using X-rays to understand Alzheimer's in a totally new way, and a brand new facility with some of the most advanced imaging tech out there. It's an exciting time for this field.
Well, let's dive right into that Alzheimer's research because this one's blowing my mind. Scientists are using X-rays to explore the link between your gut and Alzheimer's disease.
It's true. It is a very hot area of research.
Yeah.
And it really shows how interconnected our bodies are. This particular study was done at the Institute of Nanotechnology in Italy and the European Synchrotron. And they use a really cool X-ray technique called nano and micro X-ray phase contrast tomography.
Wow, that's a mouthful.
Yeah. But basically, it acts like a 3D microscope for the gut.
So they can actually see what's going on inside the gut at a microscopic level.
Yeah, pretty much. And what they found were some pretty big structural changes in the gut, things like alterations in the villi and crypts. Now, those are the tiny finger-like projections and folds that line your gut and help you absorb nutrients. And they also saw changes in specific cell types and even the presence of telecytes, which are a relatively newly discovered type of cell.
Okay, so they're seeing these changes in the gut.
Yeah.
But how does that relate to Alzheimer's, which is, a brain disease?
Right. Well, that's the million-dollar question. The researchers are investigating something called dysbiosis, which is basically an imbalance in the gut microbiome. That community of trillions of microorganisms living in our digestive tract. You've probably heard a lot about the microbiome lately and how important it is for our overall health.
Yeah, it seems like everyone's talking about the gut microbiome these days. But is there any specific evidence linking it to Alzheimer's, or is that still very speculative?
It's still early days, but there's growing evidence to suggest a connection. Think of it this way. Your gut and your brain are constantly talking to each other through this complex communication network called the gut-brain axis.
Okay.
So if something is off in the gut, like an imbalance in the microbiome, it can send signals to the brain that could potentially trigger or contribute to Alzheimer's.
So these changes in the gut, potentially caused by this dysbiosis thing, could be an early warning sign for Alzheimer's.
Exactly. That's what makes this research so exciting. If we can pinpoint specific gut changes that correlate with Alzheimer's risk, it could lead to earlier diagnosis and potentially even new treatment approaches. Imagine being able to detect Alzheimer's early on through a simple gut exam.
Wow, that would be incredible. But wouldn't a gut exam for Alzheimer's be invasive and expensive? How realistic is this as a widespread screening tool?
Those are great questions, and it's important to remember that this research is still in its early stages. There are definitely challenges to overcome, like figuring out which gut changes are most reliable as indicators of Alzheimer's risk, and developing tests that are accurate, affordable, and accessible, but the potential is certainly there. And it's a promising avenue for future research.
Yeah, it really highlights how X-ray technology is being used in ways we might never have imagined.
It absolutely does. But speaking of cutting-edge X-ray technology, let's shift gears and talk about the University of Iowa Healthcare's new facility. They're opening a brand new campus this spring with some seriously impressive imaging capabilities.
Yeah, I was reading about that. It sounds like they've pulled out all the stops to create a truly patient-centered experience.
Yeah.
Bringing top-notch care closer to home for Iowans.
Exactly. This new North Liberty campus is all about accessibility and convenience. But let's dive into the technology itself, because they've got some real gems.
Okay, I'm all ears. What kind of imaging tech are we talking about?
Well, the crown jewel is their photon-counting CT scanner. It's one of only 2 in Iowa and produces the highest resolution CT images currently available.
So this photon-counting CT scanner, it sounds like something out of Star Trek. What makes it so special?
What's really impressive about it is the level of detail it provides. Think of it like this. A regular CT scanner is like taking a photo of your insides, while this photon-counting scanner is like taking a high-definition video. You can see so much more.
I could see how that would be a game changer for patients and doctors alike. What other exciting technologies do they have?
Well, for folks who have metal implants, like hip replacements, they've got a special CT scanner called a DE Force CT. This scanner helps reduce those annoying visual distortions that you sometimes get in scans because of the metal. So if you've got a hip replacement or other metal implants, this scanner can provide a much clearer picture.
That's really thoughtful. It's great that they're considering those specific patient needs. Is there anything else that stands out?
You bet. They also have a standing foot ankle CT scanner, which, as the name suggests, allows doctors to see how your feet and ankles function while you're standing. This is a big deal because some problems only show up when you're bearing weight.
That makes a lot of sense. Instead of just getting a static image, they can see how everything works in motion.
Precisely.
Yeah.
And beyond those highlights, they've got a whole suite of other imaging technologies: MRI, fluoroscopy, ultrasound, DXA, you name it, they've got it. It's like a one-stop shop for all your imaging needs.
It sounds like they've thought of everything. It must be reassuring for patients to know they have access to such a comprehensive range of imaging services all in one place, and all of this with the high standards of care that UI healthcare is known for.
Absolutely. No matter which imaging technology is used, patients can be confident that they're receiving the same level of expertise and care, regardless of which facility they choose.
That consistency is so important. It really builds trust and confidence in the healthcare system.
Couldn't agree more. It's all about empowering patients with the best possible care and information.
Okay, so we've covered some pretty amazing advancements in X-ray technology today. On the one hand, we've got researchers using X-rays to potentially detect Alzheimer's early on by examining the gut. And on the other hand, we have this incredible new facility packed with cutting-edge imaging technology right here in Iowa.
It's truly remarkable how rapidly the world of medical X-rays is advancing, and it makes you wonder what other health mysteries we'll be able to unravel with the help of X-rays in the future.
Yeah, it really does make you think about the possibilities. Like we're on the verge of a whole new era of healthcare.
Totally. And it's not just about bigger and better machines, right? It's about using this technology in smarter ways to understand what's going on inside the human body.
That's exactly right. And I think the Alzheimer's research is a perfect example of that. Imagine being able to detect this disease before symptoms even appear. It would revolutionize the way we approach treatment and care.
It would be a total game changer. But I'm curious, how do they actually connect these changes they're seeing in the gut to what's happening in the brain? That seems like a big leap. It might seem that way. But remember, your gut and your brain are in constant communication through what's called the gut-brain axis. It's a two-way street with signals constantly going back and forth.
So if something's off in the gut, like an imbalance in the microbiome, it can actually send signals to the brain.
Mm-hmm.
And those signals could trigger or contribute to Alzheimer's.
That's the working theory. And it's pretty mind-blowing when you think about it. And it's not just the communication aspect. Remember those structural changes we talked about in the villi and crypts? Well, those changes could actually damage the gut's barrier function, allowing harmful substances to leak into the bloodstream and potentially reach the brain.
Wow. It's like a domino effect.
Yeah.
With one imbalance leading to another. And this is where those high-tech imaging techniques come in, right? They allow us to actually see these subtle changes in the gut that we might have missed before.
You got it. Those advanced imaging techniques are giving us a window into this complex interplay between the gut and the brain. It's like we're finally able to see the pieces of the puzzle fitting together.
This all sounds incredibly promising. But I'm also wondering about the practical side of things. What are the next steps in this research? What are the biggest challenges they need to overcome?
Well, one of the biggest challenges is figuring out which specific gut changes are most strongly linked to Alzheimer's risk. They need to identify those biomarkers that can reliably predict the development of the disease.
Right. You don't want to be giving people false hope or causing unnecessary anxiety.
Exactly. And they also need to develop tests that are accurate, affordable, and easy to administer. We're not talking about invasive procedures here. The goal is to create something that can be used as a routine screening tool, like a blood test.
So while we're not quite there yet, the potential is huge.
Absolutely. And it's not just about Alzheimer's. This research could have implications for a whole range of other neurological conditions that might be linked to gut health. It's a really exciting time to be following this field.
Okay, so while researchers are using X-rays to unlock the secrets of the brain, other advancements are happening right here in Iowa with the opening of the University of Iowa's new facility. It sounds like they're really investing in the future of healthcare.
They are, and I think it speaks volumes about their commitment to providing patients with the best possible care. They're really at the forefront of medical imaging, and this new facility is a testament to their dedication to innovation and patient-centered care.
It's also a big win for folks in Iowa knowing they have access to this level of technology and expertise right in their own backyard. No more having to travel long distances for specialized scans.
Exactly, and I think it reflects a broader trend we're seeing in healthcare. A move towards personalized medicine, where treatments and diagnostics are tailored to the individual needs of each patient. This new facility, with its array of specialized scanners, is perfectly positioned to deliver on that promise.
Speaking of those scanners, let's delve a bit deeper into what they offer. You mentioned the photon-counting CT scanner earlier. What are the real-world benefits of that technology for patients?
Well, for starters, the level of detail is incredible. Imagine being able to see tiny fractures that you wouldn't even know you had, or detecting subtle changes in tissue density that could indicate early signs of disease. This level of precision can make a huge difference in diagnosis and treatment planning.
It's like having a superpower, being able to see things that were previously invisible. And what about the DE4 CT scanner for patients with metal implants? How does that improve their experience?
It's all about clarity. Metal implants can create distortions in regular CT scans, making it difficult to get a clear image of the surrounding tissues. But this DE4 scanner is specifically designed to minimize those distortions, resulting in much clearer images. So if you've got a hip replacement, you can be confident that your doctor is getting the most accurate information possible.
That's such a relief for patients who have those implants. It takes away a lot of the uncertainty and anxiety that can come with medical scans.
For sure. And then there's the standing foot-ankle CT scanner, which allows doctors to see how your feet and ankles function under real-world conditions. This is essential for diagnosing problems that might not be obvious when you're lying down, like subtle instability or alignment issues.
It's amazing how far we've come from those early days of X-rays where you had to hold perfectly still for what felt like an eternity.
Yeah, the technology has advanced by leaps and bounds, making the experience more comfortable, convenient, and informative for patients.
But it's not just about the technology itself, right? It's about the people who operate it and interpret the images. That's where the real expertise comes in.
You're absolutely right. The technology is only as good as the people using it. And at the University of Iowa's new facility, you can be confident that you're in the hands of highly skilled professionals who are dedicated to providing the best possible care.
Okay, so we've talked a lot about the cutting-edge technology and the incredible advancements in research. But what does all of this mean for the average listener? What's the key takeaway here?
I think the key takeaway is that we're entering a new era of healthcare, one that is increasingly personalized, precise, and proactive. And X-ray technology is playing a central role in this transformation, whether it's helping to detect diseases earlier, providing more accurate diagnoses, or guiding treatment plans. X-rays are empowering us to take control of our health in ways we never thought possible.
Yeah, it is exciting to think about all the possibilities, but it can be a little overwhelming too. With all this new technology and research, it's hard to know what to focus on,
I hear you. It is a lot to take in, but I think one of the most important things to remember is that you're not alone in this.
Yeah.
Your doctor is your partner in navigating all of this, and they can help you make sense of it all and figure out what's best for you.
Yeah, that's a good point. We often forget that our doctors are a valuable resource for staying up to date on these advancements.
Exactly. And don't be afraid to ask questions. If you're curious about a particular imaging technology or you've heard about a new research study, bring it up with your doctor. They can help you understand the risks and benefits and whether it's something you should consider.
So be proactive and advocate for your own health.
Absolutely. And on that note, I think it's worth emphasizing that even with all these amazing advancements, there's still a lot we don't know about the human body. Research is ongoing, and new discoveries are being made all the time.
So this is just the beginning. There's so much more to explore and learn about.
Exactly. And I think that's what makes this field so fascinating. It's constantly evolving, and there's always something new to discover.
Well, this has been an incredible deep dive into the world of medical X-rays. We've covered groundbreaking research, cutting-edge technology, and even some practical tips for our listeners.
It's been my pleasure.
Before we wrap things up, what's one thing you'd like our listeners to take away from this deep dive?
I'd say embrace the possibilities. The advancements we've discussed today are just a glimpse of what's to come in the world of healthcare. As technology continues to evolve and our understanding of the human body deepens, we can expect even more incredible breakthroughs in the years ahead.
It's a good reminder the future of healthcare is bright. And on that note, we'll wrap up this week's deep dive into the world of medical X-rays. We'll be back next week with another fascinating exploration of a different topic. Until then, stay curious and keep exploring.